can't raise that chair up?
A booster seat.
I do need a booster seat. I'm not above them.
Should have asked the waiter. All right, perfect. Welcome, guys. It is Jacob Crotty kicking us here off for our daily sales dojo. To start today, I have something fun and creative. So I want to go around the room. I would just want a quick answer. Okay, no explanations, nothing like that. Grip, what is your favorite sitcom of all time?
The Office.
Frank?
MASH.
Of course. Kim?
Desperate Housewives. None of LA, the old school one.
The scripted one.
Is Desperate Housewives
Yeah, the
considered a
one, not
sitcom?
Yeah.
Yeah, what's
Okay.
considered a sitcom?
You're thinking of The Real Housewives versus Desperate Housewives. The one with
Yeah.
Eva Longoria.
Oh, okay, correct.
Desperate, yeah.
Okay.
Yes.
Game of Thrones is a sitcom?
No, it's got to be like funny.
Oh, you say funny. I guess The Office.
The Office? Okay. I heard something interesting yesterday. I was actually listening to an interview with renowned WWE superstar Triple H. Don't ask me why. Just randomly popped up. But that led me to this right here.
People will forget what you said. People will forget what you did. People will never forget how you made them feel. My Angelou.
Jacob Crotty.
Jacob Crotty. Love it. Love it. Well done, Jacob.
This is in comparison to the you miss 100% of the shots you don't take, Wayne Gretzky, Michael Scott.
Yes.
So, with this here, I immediately heard it and go, why did I just get inspired from Triple H? And he was not spitting water in the air. He did not suplex anybody. He did not pin anybody. What is going on? He said in his household, this is one of the quotes that they live by. And it hit me after I heard it. That's why it's just a quick start to this here. But man, that is true. That is true. Because everybody we talk to, they don't remember what we say.
Mm-hmm.
They don't. They're old people. They got other stuff to do. I don't remember what I said yesterday. I tell the same story every week and still forget stuff. Okay?
I forgot to tell you what my favorite show is. That was 2 minutes ago.
Yeah, exactly. There you go. Like a
Was it The
goldfish.
Office? I don't remember.
Yes, was
Yes.
the like a
Mine's
goldfish.
Mine's still MASH. Okay, good.
And we'll come back to that later. But this is something that you can really resonate with, not just in closing, not just in selling. This goes back to my book idea of Be a Decent Human, written by Jacob Crotty. This is a quote that everybody here needs to read and needs to adapt into whatever line of business you're doing. Property and casualty, life, health, pet insurance, whatever, boat insurance, hit me up. I need new quotes. But people remember how you make them feel. If you make them feel warm and fuzzy, they're going to remember that. If they don't remember who you are, then you didn't do it properly. You can say you can go through the script, page 1 to page 60, and read it word for word. They're not going to remember everything. They're going to remember a few things. They're not going to remember what you said. They don't care. They are going to remember how they felt when you did it and how relieved they feel afterwards. That's why one tip for you guys too, if you can, I know everybody gets a little busy, this is something I've been incorporating with some of my med sub sales. If they are replacing coverage, once you know it's issued, take 5 minutes.
To call them.
Call them, let them know, but cancel their old policy. So I can't tell you how much our job is to not have a headache down the road, to not answer questions.
No.
No, we don't cancel.
Remind them.
We don't cancel it for them.
Right.
I go the extra mile. I call the carrier with them.
Okay.
So I can say, hi, I have Miss Laura Camacho here. She has a new Plan G that's starting September 1st. She wants to keep her coverage for the remainder of this month, but starting September 1st, she wants to cancel it.
Right.
And say, okay, perfect. It usually takes 4 minutes, and that's with calling the company.
Right. Right.
You have no idea how much those people want that. Because they literally know that you're looking out for them,
Right.
but you're also looking out for yourself. Because
Right.
you don't get why the hell did they charge my checking account for $300 when you said you were going to cancel it? And then you go back to I never said I was going to cancel it. I said you have to cancel it. You don't have to go through the whole rigmarole. It's a little bit more protective But as long as you take the steps there, they're not going anywhere.
Right.
They're not talking to anybody. They're not doing anything. Like the lady I talked to today, she's been on the books for 3 years now. I check in with her every year. I know for her, money's a little tight. So she wants to save money as often as possible. If that means $7, $10 in monthly premium, she wants it.
Mm-hmm.
It just helps her out. Same thing with her prescription plan too. But she goes, I got to be honest. I was talking to people about Advantage plans. Saw the commercials, did all of that, but I didn't go through with anything until I wanted to talk to you towards the end of the year. I said, well, I'm glad it's your birthday. Let's talk now.
Mm-hmm.
And she was just so confused because all the commercials, everything were directed to people on Medicaid and then just the basics of Medicare. She's saying, well, they said that if I go into rehab, the first 20 days are free. I don't have to pay anything. I go, what? Rehab? She just had like a knee surgery done. She just had an elbow surgery. She's just worried where she might be thinking she wants to get all this done before getting an Advantage plan, basically. I go, what are you talking about? She goes, yeah, rehab. It's like free. The first 20 days, you don't have to pay anything. I go, what type of rehab? She's like, where you go after surgery? And I was like,
Skilled nursing.
oh, you mean skilled nursing? And she was like, yeah. And I go, that's everybody.
Right.
That's Medicare. That's not a plan. So they're not advertising their plan. They're advertising Medicare. And she goes, I would have never thought about that. And then she goes, what about this give back stuff? And I go, well, there's two different ones. You can get the give back where they'll help pay for your premium, where they might take it out, but it might take 2 to 3 months before it actually kicks in
Right.
when it's active. It doesn't immediately next week, okay, here's your $90 back.
Do they have a problem? Sorry, off
It's
topic.
okay.
Do they have a problem? Have we heard with like back pay on that? Are the carriers pretty good about that?
So when I did my AHIP, there was actually something I found interesting about that as to where there's a lot of different litigation when it comes to it.
Mm-hmm.
So as long as you have proof that you have enrollment of the plan and it started on X amount of date,
Mm-hmm.
you have to submit that to Social Security. But it's not as simple as calling them and saying, hey, I haven't got my $60 off my Part B yet. We need proof from the company of enrollment. We need proof that it is active for Medicare. You need all these different things, but you can submit it and they will just pay you later on down the road. So if you started in January, if they don't start paying in April, they just move those first 3 months back.
Yeah. Plus, they don't. It's not that they pay you; it's a credit.
Yeah, they credit out of the check.
Yes.
Right. So they basically just lower your Part B.
Correct.
But excuse me, have we heard of any particular carriers? Because I've run into this a lot, where people want their Part B give back, and I always say it's the government. It takes a minute to catch up, but when it catches up, they should credit you, compensate you for time served, so to speak.
Yes.
Right.
But do we know of any carriers that are better or worse? Because I've heard WellCare is kind of a nightmare, but I don't know.
The reason, and just because WellCare seems to be more arduous with those processes, is because they are leaning hard on that benefit.
Mm-hmm.
You'll look at different WellCare plans, and there's some WellCare plans out there that will pay your entire Part B.
Right.
You know?
Yeah, I've seen that, but it doesn't count if you don't
Exactly.
get it.
Exactly. So it can be a little bit, difficult to get that going, like any type of government entity and credit given back. But there is no, it's basically down, it just comes down to the individual client and how that application has been processed.
Right.
I'm WellCare they're trying to compete they have wonderful, wonderful Part D plans, but their competition now, they're trying to compete with Advantage plans, and they've done the research and they say, where can we win Part B give back?
Right.
So you'll see that they have astronomical differences in their Part B give back. It's just that, with any type of Advantage plan, the pendulum swings like, hey, we'll give you all of this, but we
won't give you this.
Don't pay attention to that.
Right.
That's exactly what I had to tell her when I was talking to her this morning, because WellCare was the only plan in her area, and there was 3 give backs. It was like a $20, a $40, and then a $99 give back.
Yeah.
Mm-hmm.
And it got into it where it was a $99 HMO that had almost $6,000 out of pocket.
Right.
And you're like, this is why you're getting this money back, because you're going to spend
I say that
that money. That's what's
going
gonna
to
happen.
wants cash, I say, listen, if you want cash back for your Part B, that's going to be your benefit.
It's
Because
going to cost you.
everything else,
Yeah.
everything else goes by the wayside.
So let's take a second here. like I know me and you've gone through in the past. I've trained you on it
Uh-huh.
before. Does anyone here have a firm idea of how Advantage plans are funded and therefore how they can offer little bells and whistles like that?
I think I do.
Part of the 170
Medicare.
No, it's
not.
Medicare pays commissions.
It's not.
was that they.
No, I mean, it is
Yes.
part of the Medicare.
Medicare pays the Advantage plans commissions.
It's
For
what's called a
enrollments.
capitation rate. Yeah.
Right.
So let's say, for example, if we're just going to go out and say on average you're getting $1,100, or just making it even $1,000, right? So for each Medicare Advantage plan enrollee, unless it's something special like a D-SNP or a C-SNP, which has an increased benefit on that from the government has already allotted on an annual basis what they expect an individual who's been paying into Medicare for at least 40 quarters is going to cost them on average, right? They know that many years you won't even really use Medicare. It's just maintenance. But then cancer comes, the heart attack comes, the stroke comes,
Mhm.
and it happens multiple times. So they know roughly what it's going to cost you because they've been doing this for a long time. They know what it's going to cost to keep you going and until you die, right? And they know it per region and they know it per age. And it's when you're dealing with large numbers and large pools like that, it's very accurate. So let's say the government has a capitation rate for you of about $1,100. Well, that's your money. You paid into Medicare Part A your entire life since 1966. Your employers have matched. That is yours. That is not a tax. That is front-loading commission for the government health program that is for the government health insurance program, which is known as Medicare. And then once you turn 65, you're going to pay $173 a month unless you make a lot of money, and then they'll uprate you, right?
Mm-hmm.
But at those income levels, I'm not really shedding a tear for anybody. I mean, come on.
Yeah,
I'm
it's
worth
a
$10
nice
million.
problem to have.
I'm worth $10 million. Well, okay, fine. Enjoy the roads, right? So the issue that you run into is that that's an individual's actual money, right? So when you turn around and go, oh, I'm going to give you back some of that money that the government's taken from you. Well, how am I going to, if I'm dealing with a capitation rate in which the only way I can make money for myself and my shareholders is to not spend money. Well, how valuable is that bell and whistle now? What other processes am I going to have in place to make it more difficult for you to spend the money the government gives me that's your money?
Right.
And that's when you run into the studies that happen from the Government Accountability Office where 60% of all audits come back with denials or illegal denials or delays in claims payment. It's why you have to go through extra step therapy and you got to get recommendations because they don't want to spend the money.
Mm-hmm.
And in fact, if I was an accountant and I look at, well, I mean, we're going to get so many enrollments and these guys didn't have a lot of claims, but man, if they stay on them for a long time, they might not have that issue. Or you might have to pay something. I'm not going to be really incentivized to keep them on long term.
Right.
So I get the bell and whistle and then I get my money and I run.
Right.
Again, that's why these Advantage plans change every year.
Because
So-
over and over and over.
For me, when I talk to clients, I do what you did, which is that's your money. And are you okay for the trade-off?
It's like J.G. Wentworth.
Right.
It's your money.
It is your
You
money.
need it now.
Yeah.
Or better yet,
Yeah.
how about this? How about this? Do you want to take the risk of it not being readily accessible and expendable by you when you need it? That's why a lot of people avoid like CDs and stuff and investment because they're like, well, that's my money. I might need it.
Yeah.
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 Well, why are you absolutely okay taking that chance on an Advantage plan? So, I mean, it's a different value proposition. Advantage plans are great for certain people, and generally they're people of really low income.
What other people don't see, and I've been doing a lot of reading on this, is that Medicare, the actual government entity Medicare, has done more to the medical industry in terms of calling out the cost of things better than any other entity.
Yeah.
They know how much things cost.
Mhm.
They know that a CT scan can be $800 to $1,000 instead of an Advantage plan charging $3,000.
Oh, yeah.
Like they come in and they actually say, you are not going to charge this person more than this amount because we know exactly, we've been around, we've seen the technology, we know how much it costs, this is what we're going to charge.
Yeah.
And if you have that supplement, even though it's not a worry to you, that's why people like to have Medicare because they know that things are going to be heavily regulated and you are not going to be paying more than what you need to.
The Medicare rates, and I go with people that are trying to decide between employer benefits and Medicare benefits. I'm like, listen, if first of all, it's the cost per month. I get that, but you don't understand. You're talking about private insurance rates, and then Medicare and Medicare rates. Your out of pocket can be 20% with both. You're going to pay a lot more with private. So if you're 65 and older, unless you are getting free coverage for your employer, and it is great, you need to go with Medicare.
The hardest conversation for me with those clients is we're not having a cost analysis discussion. We're having a risk mitigation discussion. And they really have a hard time seeing that.
It's all dollars for them. Yep.
Well, here's the thing. If you're taking a look at that and you're letting them engage in that level, what you're really engaging in is a cost or a price conversation. And we shouldn't be talking about price.
Right.
We need to go through and just avoid all of that shit all the way through until I get them to tell me exactly what their triggers are and go, well, fix those triggers, this.
Right.
Then that's not the problem at that point.
Right.
So, but we also have another issue, like you're talking about employer insurance. Insurance is a shared risk pool. That's all it is. It's a promise that we all put in a little bit of money, and the one person that loses that lottery gets taken care of. So when you're looking at employer plans, it's a function of the size of the employer, right? And I don't care if it's Amazon. I don't care if it's the top 10 employers in the country at 200,000 plus employees. They do not have 64 million people in their risk pool. Or even if you want to divide that even further and go just Medicare A and B by itself, they do not have 27 million people, or I'm sorry, 30 million people in their risk pool. And that risk pool is a shared risk. Medicare gets to, through its collective bargaining and going, you're going to pay what we're going to take, what we're going to give you, because you can't afford not to see our patients. Right?
So, and you're going to get paid.
Right. So if I'm looking at an Advantage plan, look at this. If about half the market goes with original Medicare A and B, the other half of the market goes with Advantage plans. But that other half of the Advantage plan market, it's paired up between like a dozen or 2 dozen major Advantage plan carriers. So their risk pools are smaller, which means they have less negotiating power. And when you said that Medicare did more to affect it, believe it or not, I was actually around when that happened. I can't remember if that was 2016 or 17, where Medicare, for the first time in its history, released what it paid for services. And the insurance carriers lost their minds.
Of course.
Because they had been, not realizing it, they had been raked over the coals because they thought they were negotiating great rates. They're like, I got 50% off. Woo! Well, they're getting charged 6 times more. And Medicare comes and goes, that MRI is like $400. And then they're like, you tell me it's not $5,000. And then Medicare looks at them and goes, hey, idiot, it was $5,000 when they invented an MRI back in the 80s.
Exactly.
They churn out MRIs. It's not a $100 million machine anymore. They churn them out like a GE every day.
That's
so,
insane.
of course, maybe you should be better at negotiating this. And it's also a bigger symptom of the entire medical economy. For every healthcare professional in this country, there are 7 administrative personnel.
Yes, 7. I know. It's insane.
I always talk to agents when I'm coaching them, and I say, if you're looking at Advantage plans, when you have to look at Advantage plans, they're going to be almost identical. There might be some fluctuations in between dental and vision. There might be some things that are more fluffier on another plan. But go to the deductibles for the CT scans and the MRI scans. That area right there is so disparate between different carriers because they're the ones that are like, that's where we make the biggest bang for our buck. And they're the ones where they can have complete autonomy whether they're going to pay it or not.
Or whether they're going to approve it.
That's what I'm saying, whether they're going to pay it.
They have to eventually approve it, but they put the hurdles in place to where
there are so many hurdles for CT and MRI scans because first, when you go to the doctor is going to be like, well, we don't know what we're looking at until we can see what we can see. So what do you got? How am I going to get paid? Oh, you have this Advantage plan? They're not really good on paying this, so we might have to go a different route. Why do you want that for your health?
God willing, if I can afford a supplement, there's no question. No question.
That's why before you even see a doctor, they're like, before you even see this doctor,
what insurance do you have?
What do you have? So we know where to go. I mean, I know it's Hippocratic oath and we're trying to do what's best for the client, but there's a difference between, look, this is going to be, like when my son had a seizure, he had his very first seizure and he had to go in an ambulance to the hospital. He didn't need to, but they're like, let's just be safe, Like, they're not going to say to you, we're going to neglect this because we can't pay it. But that is going to be taken into consideration when you have a plan that says, and plans do this. They're like, oh, it's a $400 it's a $400 deductible to get this MRI. And the carrier is going to say, well, is it necessary? Most of the time it isn't necessary. It helps, right?
Here's another question. What happens if you go to a doctor who's in network or a facility that's in network? Because like, oh, yeah, that's one of my, but their labs aren't.
Yep. Or
That's-
their anesthesiologist isn't.
Yeah.
Or yeah.
That's so terrible.
And
Yeah.
you're like, oh, well, that 50% copay with no cap on it until you hit your out-of-pocket max.
Your co-insurance.
Yeah, your co-insurance is not going to be fun on that one. Get ready, because this is the other problem people face. Once you're in that position and you're too sick to get a supplement, you're hitting that max every year.
Oh, yeah. That's
so
it.
now you
It's
might
a
as
lot of whammy.
Now you got to look at this. Okay, well, get ready to pay $7,000 out of pocket. Because that's going to be your life. And we have to make sure we try to mitigate that for changing it every year, but that could have been gone.
And if you recommend it to a different facility, get ready to pay that $10,000 PPO max out of pocket.
Right.
11.5.
And there's and it keeps on going up every year. Here's another thing. By the way, people go, I can't afford it. I'm sorry, unless you are Medicaid eligible, which in that case, Advantage plans and D-SNPs make sense.
Right.
If you are Medicaid eligible, fine. Get all the free stuff and get them paid for your cable, whatever, free dental, whatever you can, because that's the world you live in. However, who can't afford a high deductible G plan?
Yeah. That's when I only sold subs and I sold against Advantage, I looked at that and said, high deductible plan G still makes more sense
Right.
than an Advantage plan, unless you're in California, in LA.
Why?
Because they have,
Their HMOs are insane.
dude, and I don't understand how they can do that. They have $800
Because-
max out of pocket. I mean,
Yeah.
all day, every
Is
day.
that still the same case now?
Yes.
Yep.
Yes.
California is very, when it comes
Kaiser
to
Permanente?
No,
Med-
even.
no,
no, everywhere.
Anthem?
Anthem,
Yeah.
WellCare.
there's the
UC.
UCare, I think
Wait,
is
you're talking
one
about
too.
LA
You
County
here's
specific.
Minnesota.
Yes, definitely LA County. Like there are a few zip codes in California, and I know LA is one of them
Yeah.
that just have hands down I don't know if I would skip if I wouldn't be on an Advantage plan if I lived there.
But they're only HMO.
Yeah.
They're only
Only
HMO.
go to
Yeah.
that
Then you're
doctor.
They're
If-
only
yes,
HMO.
Exactly.
Yes.
If you had somebody who was just starting Medicare, and they were like, I want to get appointed everywhere to do just Medicare
Right.
Advantage,
Mhm.
I would not recommend you get appointed in California.
No.
No. There's, number one, too much competition.
There's a lot of competition.
If you go into the actual Medicaid side of things, there's little to no Medicaid plans available
No, because their plans are so amazing.
because the plans are so regular
Medi-Cal
that
has no
they go
problem.
we don't need. We're okay with just Medicare
Yeah.
Medi-Cal.
or
Medi-Cal,
Medicare and Medi-Cal.
Yeah.
They go, we're just fine with that. You can just keep that. It's okay. You just won't get any other benefits.
Right.
But every person who you talk to in California, you're going to talk about the difference between basically $1,000 deductible and an $800 deductible and $700 worth of dental versus $800 worth of dental.
What'd you
And
say,
is this a
Jacqueline? Max
network?
out of pocket.
But and the worst thing is they're all local companies.
Correct.
Yeah.
There might
All their
be
networks are
there
all
might be
local.
15 offered.
Yeah.
But you talk about United Healthcare, Aetna, Blue Cross. Out of those 15, you might only get appointed with 3 of them because you're not a California resident.
Well, here's my thing, though. I've sold hundreds and hundreds and hundreds of California.
Advantage or
Right.
supplement.
Supplement.
Okay,
Yeah.
we're talking advantage.
I know,
That's
but no, we're
yeah.
talking supplement earlier, and we keep on bleeding back into this. I've never had a problem selling anyone in California a supplement, even in facing an Advantage plan, which, by the way, the Advantage plans for a very long time in California, if you were looking at an Advantage plan that was a good Advantage plan, it was Kaiser,
Right.
right?
Which still is.
It still is.
Yeah.
It still is. Yet you crush it every time because when I'm talking to California people, I'm talking to either above average or high net earners.
Yeah.
And you're not telling someone who has worked their entire life and makes a good amount of money and whose little hovel of a house is worth $2 million that they need to go see a doctor that an insurance company tells them.
Right.
It's a different value prop. So when
Yeah,
we
it
talk
is.
about, well, this plan that has this dental, this, that doesn't matter. if
That's
you
why
get
I
in on it.
prefaced with if you're doing Medicare Advantage
Advantage,
plans
yeah.
to
Well,
not get
it's-
appointed in
it's gotta
California.
be-
Yeah.
It's got to be the
Yeah.
lower.
How about just don't do Advantage plans unless you absolutely have to?
Yeah.
I mean, we have them as a backup. But we can this time of year we're doing a lot more.
Well,
of them than
I've
usual.
noticed that in those Advantage versus Supplement conversations in California, the majority of the people that I'm doing Advantage plans for are healthy. So their concern for health is, I don't care. I just want to have something in place. I go see my doctor down the
Then
street.
don't get insurance
And
just have Medicare.
But that's what I'm saying is like, don't you? And I always lead with med stuff. It's like, look, you have a situation where you can get a high deductible or even a regular plan G.
Mhm.
Like you can, like they have California
Birthday
birthday rules
Mhm.
where we can review it every year, and you are always going to have the lowest plan G ever. And some people are like, that's great, and we do that route. But also they're like, no, I'm just happy. I don't mind the $900 MOOP.
And they've got the IPAs. The IPAs out there are ridiculous.
Yeah.
I can't even wrap my head around those two different levels. When you're looking for networks for Advantage plans, and then you have to go, okay, the doctor's a network, but is the IPA? And what? Like
Yeah.
I know Texas has IPAs too, but they don't seem as
We
prevalent.
do more HMO POSs. Like that's kind of similar to the IPAs, where you do have that leverage to kind of put your scan out there to see who will accept that HMO, even if they don't. It's like it's on a case by case system.
Does anyone else see the amount of chaos in this conversation when talking
totally
about
chaotic.
Advantage plans?
Yes.
I mean, let's be honest here. The
It
whole
is.
point of actually being able to give good service and quality of service to an individual that makes them want to buy you as an individual, not the plan that you're providing.
So let me ask you this question. Let me ask you this then.
Right.
Like that makes sense to common folk. Like I want to avoid the hoops, but these people that we're talking to, especially the past couple months, they're willing to struggle through the hoops
For the benefits.
for the benefits. So
That's
how do
because-
you work through that?
Don't talk to people that are on Medicaid.
Uh,
I mean, can we just put that out there? If your market that you're targeting right now, which is what we've dealt a lot with this, and we're getting more sub people in now, right? Because there's not a whole lot of us. We can only test so many lead sources at once.
Right.
If you are fishing in a very, very, very dirty pond as far as what people can qualify for, what they can really afford, or better yet, how about this? If Medicaid's paying all the bills, then what are you doing? You're just looking for extra benefits.
Yeah.
Right.
That's the only thing you can trade on. So
Correct.
we have to be very conscious of this and take it out of our heads of, but that's how you sell shit. That's not.
mhm.
Right now, with people that are dealing with DSNP people, and the DSNP people that we deal with included, what we're doing is we're going to end up poisoning ourselves and going, oh, well, the only way I can sell anything is to just give away free shit.
Yeah, no.
And that's not where you want to be. You absolutely need to be in a period, because they're not. If I'm actually going, hey, this is free, this is free, this is free, it's always going to be a situation, well, what more free do I have? You have no persistency.
Yeah.
People don't
Can't
stay
trade
with you.
free with free.
So let's not keep talking about let's not keep on approaching people that are literally the people that we're just giving everything away for. There's no value in nothing but gifts.
Let me ask Kim, because you've been talking to a lot of Medicaid people. What has your experience been with that? Have you like talking free to free? Because it's been a challenge talking to these people. How's that been for you?
Well, that's kind of how I approach them. So I'm kind of
Free.
sitting here going, what is he saying? Am
Right.
I not doing this right?
Right.
So and you're right, everybody that I talk to is on a D plan, dual
Right.
complete plan. They're Medicaid, Medicare,
Right.
whatever. So, I basically just ask them questions about, do you pay any of your bills? Well, I didn't used to, but now I do. Well, somebody might have put them on an HMO. Maybe they didn't check their doctors. So that's always important. But basically, I do tell them, everything, if you're not paying anything, that's because Medicaid takes care of everything. So really, the only thing to look at are the benefits.
Mhm.
One plan may have $1,000 dental, another one $5,000 dental. So let's make sure you're getting all the benefits you're entitled to. I mean, that's just our key phrase all the time when dealing with these people that are on
Right.
And,
the dual
and
plans.
you can't talk about stuff like what you're talking about is either T65 people or people that are already on subs. Because if you've got anybody that calls in at any time of the year other than AEP, it's going to be, if they're already on an Advantage plan, it's going to have to be an Advantage plan conversation unless they're VA or moved or something like that. But that it's a target market as far as leads are concerned.
Well, I think also the other thing we get conditioned on is this. Right now, the call-ins are DSNPs, dual special eligibles. The issue that you run into with that is that if we sit around and we only actually take those calls, then that's all we're doing. right? There's other lead sources that we're pulling in that are going to
Call out.
be, yeah.
Yeah, I prefer to call out. I'd
Right.
rather not take the calls. I just can't stand here. Ring, 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 ring.
I know, I get it. And by the way, it's something that we can't overly criticize because, take the money.
Yeah, we have to. I mean, we have to pick up.
We
the
have to
call.
be practical in our application of it. We can't think that that's actually what we should be doing when we can interact with their clients. And I hear it a lot. We'll see people coming up and like they'll call out a person who's, a high net worth earner that's out in Utah. And I'm like, why are we talking about free shit?
advantage. Yeah.
Why? Well, they're not going to qualify for that. They're not going to do it. We haven't actually done the conversation. Why are we pulling up marks right away to see what people are doing? Why are we doing all these things instead of actually building this conversation? Because I'll tell you what, the things that actually matter in a conversation with a person, whether it be how you build value, right, before you even talk about price, it's uniform whether you're talking to someone that's on Medicaid or whether you're talking to someone that's worth $1 million. People don't change that much. But if we start getting the conversation in there because they're like, I want extra dental, well, let me just focus on that.
Mm-hmm.
Well, now, man, there's a bigger conversation. So that's my issue that I see a lot of. People get adjusted to and used to because they want to shortcut a process of going, this is what I think they are. Yeah, it's pretty much that. They will never forget how you fail.
Yeah.
And by the way, I'm sorry, if you're getting paid like a commission of $500 or later on in the year, $300, whatever it is, to do something for somebody, even on a D-SNP, maybe you should do it right.
Mm-hmm.
Right? What else are you going to do? You going to wait around for another call in? No, just do it right. Maybe they won't, when they do switch the next year, because they're going to switch the next year, they'll call you back. But at the same time, you need to keep those skills open so you can talk to someone that needs to get a sub. Because I'm telling you right now, if you start going, well, what else do you want for? There's nothing free.
Right.
You make too much money and you've set that precedent. What value can I give you? Well, you're not going to project your values on me because I'm the customer. So why don't you ask me what my values are, what I need?
I think a lot with staying in the Medicaid, but then also kind of reeling into people who are not on Medicaid. What gets to start to creep in your mind is the worry about, can they afford this? Does this look too much? Is that okay?
It's not my judgment call.
But it creeps into people's minds when all you do is free, and then you have to switch over and you're like, oh my God, for this person who's 65 in Oregon, this plan G is $165. Oh man, their best option for a drug plan is $45. Oh man, their dental is going to be $50. There's no way they can afford all that. That's what happens when your whole mentality is, let me help this one set of people and do this one thing and approach it this way, and that's the only way I know how to do it. When you compare free to free.
Yeah.
And then guess what? When you have to bring in premium and somebody's got to pull out a checkbook, they don't just get it sent to them, then that's going to set in, and your mindset's going to change from going, this is about the value proposition, not about the monetary proposition.
Right.
Yeah, I mean, my issue isn't that, I don't know. If they're already on an advantage, that's my transitional issue. If they don't have anything, or if they have a sub, if they don't have anything, or they're trying to decide what have you, listen, you pay for convenience all your life. That's what you do, and that's what a supplement is. It is convenience. It's luxury.
Well, it's not just convenience or luxury. It's an essential item because I have made a career out of switching people off Advantage plans. Because they'll get curious and they'll come over to our website and they'll look and go, I have a supplement. It's an HMO. And I'm like, no, you don't. And there's the thing, because then you start asking the questions because you're not going to win that zero premium fight. So let's have a different fight.
Right. Let's talk about the value of a supplement. Right. Because after age 65, I don't feel like that's when you should start trying to save on your health care. It's not a matter of if, it's a matter of when.
There's an entire group of people that don't know the difference because their agent signed them up with a simple thing.
Yeah. Right. And a lot of people don't realize that aren't on Medicaid that there's a max out of pocket. I tell people all the time, do you realize that if you're hospitalized, I mean, it doesn't take much to rack up tens of thousands of dollars. Do you know that you're responsible for $6,700 right off the top per year? That's like a deductible. They're like, no, no one's ever told me that. But then I've got a supplement that's $100, or you can do $1,200 a year and go anywhere you want. So it is a different conversation.
No wait, no fuss, no paperwork.
Yeah, don't have to worry about
the doctor you want.
No one telling you what to do. I can't
wait to get back to that mentality of getting rid of the free stuff. I want to talk and sell that so bad.
It is a simple way out. Because we have Advantage, let's compare Advantage. But you're right. I shouldn't be doing that. If they have an advantage,
You can't
I
make
should. Well, do you know about supplements?
Or better yet, do you know how your thing works?
Do you know how this healthcare works?
What I used to hear all the time? Well, it works really good for me. And I go, yeah, because you haven't had to use it.
Right.
That's
Right.
the other
And
question
that's the
I
thing.
ask.
Like
You've been very healthy. Oh yeah, I've been incredibly
You must be
healthy.
healthy.
Yeah, that's what happens.
That's why
Everything's
you don't
great
know.
until you have to
everything's
use it.
great on
And
an
they go,
advantage plan if you're healthy.
what do you mean? I'm like, well, let's look it up here. Look up right there.
Mhm.
Oh, you're in an HMO. So right now, your current doctor said, well, I had to go find a new doctor. Did that hurt? That sting leaving your old doctor? I really wish I could have my old doctor. Yeah, you can.
I just had
You know?
I just had
Yeah.
a little epiphany because you're right. When I only sold subs,
Right.
I got
You
people that
killed
plans
Advantage
all
every
day
day.
long.
And here you are. You were now 2 months into working with people and they're working with Advantage plans, and you've already changed your mindset.
All day long, yeah, all day long. I took people out of advantage plans.
We need to be very cognizant of that, because I'll tell you what happened. I went to this conference over in Utah, and these guys are not bad guys. In fact, I'm not talking about the conference. Conference was great people, but I talked to a guy who was at an event at the conference, and this guy's a very nice guy, a very affable and an honest guy. He's a younger guy. He's pretty smart. In the few minutes I talked to him, for me saying that's a big thing. Right? Look at Jacob. He's like, oh, nice.
Well, no, I know who you're talking about. Go ahead.
He's smart.
Yes.
No, you don't know what I'm talking about.
Might.
No, he's not a public. He's not one of these public guys that you follow on all your social medias.
Just make sure.
Uh,
That's fine.
No. It's not any of those guys. But he started a little phone sales group, right? And all they do is a Medicare Advantage plan. In fact, you probably know because he's worked at one of your organizations in the past. And I'm sitting there. Oh, we primarily do subs. I also do Advantage plans. Oh man, I got to tell you, you shouldn't do subs. Oh, excuse me.
What?
Why shouldn't do subs? Well, I mean, it's not good for the client,
What?
right? This guy should know
What
better.
was your face? Were you able to control it, or were you just
What's
aghast?
your face
Steve
doing?
Fontel had words about my face because it was absolute like confusion at first. Like,
Right.
what the hell did you
What am I
say?
hearing?
It's not good for the client.
What am I hearing?
Did he, what
Right.
was his?
Well, the financial justification, because even out of pocket and all the and
No.
it's less expensive, so it's better.
Started turning
And I
green.
went, and I said, so how do you determine what's better for your client? Well, I mean, it's just a dollars and cents thing. I go, are you just talking to? No, I talk to everyone across the spectrum, and that's what we do is we get them on Advantage plans. It's a better deal for them. I go, again, how do you determine what's a better deal? Well, I mean, it's just, you can't beat zero premium. And what this guy has done, he's gone through, because I know the environment he went from previously, and he has completely changed his own directive on what he's doing to justify his own action. It's easier to do that. Therefore, I have to justify it somehow, and eventually you're going to con yourself.
Yeah.
We had this conversation today. It's easier to stay mediocre than address why you're mediocre.
Right.
Yeah. Yep.
So instead of learning how to actually make a sale, right,
Mm-hmm.
they're going to go ahead and price drop. And what's the best thing to price drop? Zero.
It's also
And then once you get below zero, which is what they're doing now, they're eating into their profit margins because they want to give you free shit, which isn't free. It's coming out of your money.
Yeah.
Yep. It's also an agent thing. If you start blaming the lead or blaming the phone call, blaming the whatever it is,
Can't do that.
if you start sighing, you're in my head, if I hear that at 8:45, you're done for the day.
Yeah.
You ain't selling
You're
anything.
checked
Here's a question.
out. So-
Here's a question. If freedom doesn't matter, if choice doesn't
Mm-hmm.
matter, right, then why are there Advantage plans that are PPOs called like Humana Honor or, United Healthcare Patriot?
They're for the vets.
They're for the vets. And the
Right.
vets have free health care.
Right.
I'm in the VA. So if that doesn't matter and you have 100% free health care and a creditable drug plan, you will never have to pay for anything. And they'll mail these drugs to your house, and you guys can't get those drugs at your house.
Right.
Right? But they'll do all this other stuff, yet I still want to choose. Then why on earth would anyone think that Advantage plan only shops are a good idea? I mean, to not even have the conversation of choice with the person and to go, hey, maybe $35 to $150 is a great deal for you for that peace of mind. If we're not having that conversation, then shit, would you just post it on a website and push a button that says enroll now? Oh, wait, they tried. Obamacare, and they still need people to explain it and build value.
I have to change my directive. I can't even believe that I just realized that because I've gotten away from having that conversation when all I ever did was have that conversation.
It's insidious how slowly we do this to ourselves.
That's
That's
crazy.
Yeah, when I first started with that company that we all worked at before, is all they did was supplements when I first came on, and they drilled into our head, Advantage plans suck, they're terrible. Anybody that has one, you need to get them out of it. Well, then they started introducing Advantage plans to us, and now they're not so bad. And so now this is why, and this is how they work. And it was. So when you're talking about the mindset,
Accountants
I
started
totally
running your
get
company,
that.
not insurance agents. That's the problem. Accountants and marketers started running your company, and poorly.
Yeah,
And that's the problem. You didn't have insurance agents in charge anymore.
yeah,
And you're an insurance brokerage. You should have that.
right.
And that's the problem. I mean, this isn't a. This is something that's cross industry. I got to tell you, there's very, very few people either in the business to business or in the business to consumer worlds that know anything about sales. They don't. I mean, we really don't need to buy much. And even the self-sustainable people out there, they still buy a Medicare supplement, right? It's the peace of mind that you get. That's what you're buying. It's the promise, and not. And by the way, Advantage plans are very open. Oh, we pay the actuarial equivalent of Medicare A and B. Then why the hell do I have you? If you're required to pay the basic stuff that Medicare pays, but not at the same level, in fact, sometimes worse. A copay on the average doctor copay. Last time I checked on this was a few years ago. The average primary care doctor or regular family doctor health visit for somebody under Medicare was like $105. That means your 20% was just over $20,
Yep.
right? Well, there are Advantage plans out there that charge you $40 a visit.
Yep.
You already start off worse.
And that's how I sold the high deductible. Because I'm like, listen, let's take these three scenarios: your
Right.
Advantage plan, your high deductible, and the Plan F that everybody's told you about. But that's why, because a lot of people shied away from supplements because the Plan F, that's way too expensive. Well, yeah, it's not economically sound either. Like, that's not the best.
No, the
plan.
G is.
Yes, exactly. It's not the best plan. Yes, it pays the most. It's not the best.
Yeah.
But when you break it down like that, I say, you're talking about Medicare's negotiated rates. You're not talking about I took a drug test one time to go, my very first brokerage. $3,500 was the bill that my insurance carrier got for a drug test. I was like, that's private rates.
Are they putting drugs in the
I
urine?
right. I would think
that's
so.
it's like that's a.
I mean, like,
Because that sounds like they had to add something to it to make it worth $3,500.
It was crazy. And then you look at the Medicare costs, and they're more on par with what they should be. So 20% of that with a high deductible plan, you're not doing bad.
Yeah.
You're not doing bad at all.
The genesis, when you look at the history of an Advantage plan when it was designed, they were not designed for sick people.
No,
There must be some misunderstanding.
there must be.
Get it?
Listen,
That's a
you
Genesis
guys
song.
wanna know-
Thank you.
You guys want to know where the
I
real
got it.
genesis
Thank you.
of Advantage plans came from?
The Collins
you guys want to know
household.
you guys want to know the story
No,
of it?
please, because we're going to be here for another hour.
Here we go.
Medicare's
Yes.
not
I'll
one
keep
of
it in
the-
less than 5 minutes.
Okay, please
Oh,
do.
All right, in 2001, we were in the middle of it was reasonable that this happened, but there was a movement in this country, like the Promise with America and all this other stuff, where everyone kept on saying, government can't do anything right. Government can't do anything right. Blah, 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 blah. Private industry can do everything
Well,
right.
there's a major catastrophe in 2001, if I remember.
Oh, yeah.
Yeah.
The dot-com bubble. Apparently private companies.
No, there's something else that happened in 2000.
maybe two.
Yeah, no.
Well, let's see. There's always, and by the way, in the 90s and late 80s.
9/11, Frank.
9/11.
Come on, Frank.
Oh, sorry.
Jeez.
Mike
You're
Piazza
right.
with the American flag running out of Shea Stadium.
Okay, but this
Okay.
is, yeah, I get it. Okay, but this also came from a result of late 90s legislations and
Okay,
lobbying.
that's
Okay.
fair. Yeah.
So in 2001, they passed a rule saying that it established what was called the Medicare Plus choice plans.
Mhm.
Epic failure. They were the first Advantage plans, right? So everyone out there went to all these private healthcare companies, not insurance companies, healthcare companies, and said, hey, we're going to just give a shitload of money that's Medicare money out of this Medicare trust, like hundreds of billions of dollars. And you guys can run their healthcare instead of the, and do the insurance for them instead of the government doing it. And you guys have money, right? They're like, oh yeah, we'll save money. Yeah, we'll save money. It's like, you can do it for like 5% less than what we can do it for. Yeah, we can do it for 5% less. That's easy. We're smart, and the government was like, sure thing, go ahead. And no one looked at the law of large numbers. And these healthcare companies immediately came back, within a year, came back to the government and said, so we got like 25 million people on these plans, and we can't run them for what you're paying us. They went, well, we're paying you the 95% that you promised that you could operate on. They went, yeah, but we actually need 117%. And they went, okay, and just gave it to them, right? And that became the Advantage plans. They rebranded that stuff the Medicare Advantage program when they introduced Part D drug plans. And a lot of those Advantage plans could operate because they were offering drugs before and other ancillary benefits before that. But the problem is that it's always been a shell game. Law of large numbers kicks in. I'm not going to take a smaller risk pool and cost less unless I'm cutting services.
Yeah. Yeah.
That's what happens.
Which is how Advantage plans are measured for their existence.
Right. So fast forward, we have the same problem. And by the way, the Affordable Care Act, only thing it did was reaffirm the state's ability to regulate insurance, and also reaffirm that you have Medicare supplements and Medicare Advantage plans. And they didn't really make any material changes except for one. Originally, they said back in 2015, they passed a law saying, hey, Advantage plans, get ready because you're going to have to deliver on that 95% promise.
That's why those MOOPs are going up.
Yep.
Right.
I would not be surprised to see these new Advantage plans for 2023 increase their Part B because that was a new
They
thing.
keep on deferring it and trying to protract it, deferring and protracting it. Bottom line is this: we cannot continue to afford to pay Advantage plans 117% of something we already paid for.
Yeah.
So if the government really wants to fix, you know what? I'm going to step on a limb here. You really want to fix a lot of healthcare in this country because there is this built-up bullshit burden that everyone's put out there. How about this? Let's go ahead and extend Medicare's age down.
That's the conversation.
Medicare for all.
Not Medicare for
60. They're going to 60.
No, but I'm talking about everyone who's worked at least 10 years or immediately everyone who's actually done federal governmental service. Go ahead. If you keep the stipulations the same.
Okay.
If you've worked 10 years and you paid into it for 10 years, which is your current qualification for getting Part A,
Yeah.
then you have the option of going ahead and activating your Part B if you choose, or deferring it to retirement, or you can go ahead and get private insurance, or you can have your work insurance. There could be deferments or cuts. But the bottom line is this: without having just going through and going, okay, well, it's okay that these insurance carriers keep paying exorbitant costs and having these fights with healthcare carrier companies that are pocketing trillions of dollars. Your doctor doesn't make that money. And it's not like it was in the 80s where we have like tri-paper, multicolored copies. I know you guys are young, so you don't remember having to fill it in. And there's
I'm older
like
than you.
triplicate. Oh, well, you just don't look at you, bastard. Your luscious hair. No, so
I did the jib at the camera.
That's right.
right. So why don't we just look at it this way? It doesn't take 7 people to process a claim like it used to.
Correct.
But they still charge for that. But there's all this. But Medicare doesn't pay for that. Medicare goes, like you said, I've been tracking costs since 1966. I know that MRI doesn't cost $100 million.
Right. Yeah.
Right.
Yeah.
So
They're the cost police.
right, and they have ICD-10 or IEC-10. I can't remember which it is. It's
The coding.
coding, and it's unified.
Yeah.
So it doesn't take a rocket science, but we're still paying companies billions of dollars to do it. And I get it. Doctors are not accountants. In fact, doctors have a very high bankruptcy rate because they're not accountants.
Right.
They're body mechanics. But, I mean, we can have all these conversations. Bottom line is this. There is an entire industry built on shuffling money, right, that's already paid for. And I want to keep as many of my clients out of that as possible.
Mm-hmm.
And if you want me to sign you up with an Advantage plan, I will not turn down your business.
Can I ask a question real quick? This might be off topic, but it's going to stay within topic. What does it take to be an actuary?
You're a super accountant.
Okay.
You're just like, you're a beautiful mind.
I've been fascinated with actuaries and how they create prices.
Oh, so they go, okay, well, this is the projected mortality of.
So let me ask you
condition.
this: an actuary, when they start to set costs for whether it's Medicare supplement or even risk pools for Medicare Advantage, who do they work for? Do they work for the carrier or do they work for an actuary company? Like, how do actuaries function?
Do both.
You can do both. Okay.
So a
Who
lot
do
of
they
companies,
Yeah, that's my question.
subcontract out. A lot of companies
Or
subcontract
who
out
they
their actuarial
benefit?
firms.
Whose court are they in?
They're in whether they are contracted to that insurance carrier or that healthcare company, or they contract or they work directly for them. They are in the court of their client, which is they have to prove, or they have to go, this is what the premium's going to be because these are what the claims are going to be per
Right.
population.
That's their main purpose.
So they're advocating. They're basically advocating. They're trying to keep their clients' best interest.
They're not advocating anything.
Okay.
They're putting out tables and go, in this area, this is how many people with cancer you're going to get in this type, in this age bracket.
But they also
So
have
that's
to
what it's gonna
work
cost.
in. They have to work in with each other actuaries, because if they go out and they have this data and this number allocation, they have to say, all right, this is what I found, and they go back to United Healthcare and say, okay, this is what the premium should be based on this amount of claims in this county.
Right.
Is there another actuary that's going to come up with almost identical numbers and go to Anthem and say, this is the data that we found in your claims? Because when you look at premiums, not just at the community rate, but just an actual like attained age, they have those data running on point, and those prices are not that much different.
Think about this, like with the Medicare supplement, right? Because those are also set off actuarial tables. Not every carrier asks the exact same health questions.
You're right, Frank.
So one carrier will have a higher tolerance for cardiovascular issues. The other carrier doesn't care about, or they really are hard on pulmonary.
Yeah.
They'll pay the extra claims on this to get that business, but they don't want to pay the claims on both. So that's where actuaries come in. They go, what can you target per area to still be effective and profitable?
And if you go back to last Friday's dojo, that's what I talked about up here
Yeah,
I wasn't here.
when we did the nobody was.
Is Jacob?
Poor Adrian fell asleep over there.
Well, I'm sure-
I had to keep saying his name just to make sure he was still alive and the recorder was still on. Yeah.
None of this is insidious. This is just
No,
Yeah.
this is data.
it's data. But here's the thing.
Yeah.
The bottom line is that we should always, with our clients, start off with our best foot forward. And that is a Medicare supplement plan, and then the fallback is a Medicare Advantage plan.
That's the
Period.
Here's what's funny, because I've been in a slew of T65s here, and it goes back to this right here.
Right.
Guess how many discussions I have had in the past 2 weeks, running mainly just T65 referrals, about how much out of pocket an Advantage plan is.
Zero.
I have never
Zero.
brought it up in 2 weeks. Why?
Zero.
Because it
It's irrelevant.
doesn't need to be.
How many of those people bought an Advantage plan?
Zero.
Exactly. So why are we
Exactly.
bringing it up and why are we talking about it? Right.
Exactly. And so if they have a question, believe me, I'm not going to deflect it. I'm going to say, no, it's terrible. I don't want to talk about it. And say, look, what do you want to know about it? Because I can tell you everything you want to know, but based upon what we've already discussed here, it's not going to be what you want.
Can someone raise their hands if they would put their parents on one of those?
Not a single person
Anyone
can.
raise hands? Adrian? No?
Adrian,
No? Okay, yeah. So sound guy, film guy, no. So here's my question on this. I find that, and this is something really on the floor, like Laura was still looking at, she's like, oh my God. I'm like, yeah, we're having really detailed conversations about something that's not the best option for our people to start with.
Yeah.
And you know what we're doing? We're really just grooming our brains to be able to go, this is okay.
this is acceptable. It's fine. I can put it on an Advantage plan. It's zero premium.
Right. Oh, it's the best Advantage plan out there. I'm like, okay.
Because these people, who we talk to, and the majority of the people we talk to, they don't care about price. The lady I talked to this morning is 74 years old, and she goes, Jacob, my birthday is next month. I'm going to be 75. Do you know what I don't want to have to worry about? Bills, and are my doctor, are they in network? She goes, I'm too old for that. She's had a Plan G ever since she was 65. But she just frankly goes, even the cost aspect of it. If you could tell me that it was $0 for the entire year, but I had to do all my own paperwork and find all this stuff out, she goes, I wouldn't even look at it. It was because I've done my time. I did that for years. Ever since I've been 65, I haven't had that responsibility. And guess what? I have the money to pay to not have that responsibility, to do it to somebody else.
I have the freedom and the flexibility to go wherever I want, whenever I want.
And just not worry about it.
And that's because you're old, dude.
You're
Like,
old, yes.
You're going to have some health concerns.
Let's not break it down to old. Because I know if you guys had an option to buy a G
when
plan.
I'm old, I want that.
If you had an option to buy a G plan tomorrow, you would do it.
How about high deductible?
I would buy then, but
Either
you'd
way,
do that for me.
would you stay on the? Would you go get a group plan or an ACA, HMO, or PPO? Right?
I'd get a high deductible.
You get something because it's automatic and you know what it is. And
Exactly.
it's easy to deal with. Right? I mean,
Are we still friends if I get an N?
dude, you want to take that chance?
You want them excess charges, son?
Why would,
Do you know what Mayo does? Mayo Clinic?
why,
They make you sign a piece of paper to start.
why would you, especially here in Texas where they charge those? Why
That was from
on
the
earth
Frank
would you-
Bryant Chronicles right there. Yeah, you want to go to Indiana Anderson? You got to sign a piece of paper right when you get there saying, yes,
All right.
you are being
You know
charged.
what? I am.
Go get a high deductible G if you want.
Okay,
a
that's
G
fair.
Yeah.
You know what?
That's what I'm saying.
That's
I'm on camera changing my way.
Wave of the future.
Wave of the future. I'm getting a high G for grip.
G.
High G.
I'm getting a full blown G because I know I'll use it enough to justify that extra cost versus the $2,500.
See, you know what also cracks me
We're
up?
healthier than you. That's
Yeah.
why. You have,
Yeah.
That we know of. But, you know, the funny thing is,
Also, locks in my rate because I use tobacco. So
That's true.
the funny thing is that if I had a plan G with some of these people, I would not even be afraid to go to the doctor and have them diagnose something. But then in the back of my head, I'm like, man, I got the best insurance ever here. I can go do whatever I want. But guess what? The minute you do everything you want, you're going to get everything in your record.
Yeah.
And then you got to go from there. But hey,
that's fine.
it's
Yeah.
fine.
By the way,
You
most of
have
these
the
issues
best
are
insurance.
fine. Most of these issues, you catch them early, get them done within 2 to 5 years. You're good.
Mhm.
My family history of cancer. If I don't have cancer, I'm going to be disappointed.
You are technically
That-
translucent. Yeah.
Seriously.
I mean,
my mom passed from it. My dad had it twice. Like, I am next. Unless it skips a generation, hopefully. But my doctor's like, for the love of God, Grip, come get your colonoscopy ASAP.
a lot of people
I'm
get
44.
tan.
God, you are old.
A lot of people.
Thank you, sir.
I mean, a lot of
Thank you, sir, in the back
My
there.
doctor's like, get your butt in here and we got to get the colonoscopy going. I'm like,
Other people tan. Just everybody Grip just has one universal freckle that grows.
Yeah.
You know.
I'm like wine. I'm either white or red. That's all I
So, but, I mean, that's one of the conversations. And by the way, I don't know if you'll kind of passion black or white on this, but it's okay because that's the way I treat my customers on it.
Yeah.
I'm like, hey, no, I'm not going to recommend that. I'm not here to make you feel better about a bad mistake. I'm here to give you advice.
Yeah.
But that's also another thing. I've gotten real tired of hearing the justifications for agents just wanting to feel better about what they do or wanting to take the easy way out. And really, that's what it is. I don't want to have an hour-long conversation with a client, so I'm just going to go, it's free.
Let me ask you this question. Has there ever in the history of Medicare supplements made changes to the structure of a supplement? Like, for example, when
Yes.
the Plan J came out,
Yes.
the Part D came in, so the Plan G became obsolete.
No.
But the Plan F, because the Plan J was more structured toward pre-Part D assistance, Plan J helped with your drugs and also covered the full 20% and then some.
Well, so
My question is, has there ever been a time where, like, let's say, for example, because I'm just foreseeing this, like the Plan F was the best cost, was the best plan 4 years. And then the Plan F became expensive. And now Medicare...
because people weren't signing up with it, you couldn't sign up with a new one.
That's correct. And plus, Medicare was tired of paying the 20%.
Medicare
Or paying
actually,
the deductible.
Medicare and all the doctors, Medicare and the government accountability government GAO, government accounting offices, all said that was a stupid rule to implement because what you're going to do is you're going to lower early detection and cheap treatment when it's cheap.
Right.
All right. But my folks, conservatives, said, no, they're using it too much. There's no such thing as using preventative too much.
Right.
I'm sorry. The outliers that you're looking at are cases, you're just trying to attack Medicare.
They're not even covered.
They're not even covered. And by the way, if you're attacking Medicare, right, you're attacking what people already paid for.
Right.
So you're trying to steal from them, and I'm not really down with that.
Not at all.
It's not an entitlement; it's an earned
So
benefit.
going back to my question, like just seeing the trends, like Plan F was the golden plan. Then now they're like, well, the Plan G is the golden plan, which I agree. 20 years, well, 30 years for you, but 20 years for me.
So I got
Do
it
you
all.
see like them
I
saying,
got it all. Yes. I
okay,
do.
answer the question, sorry.
All right. So here's what happens with Medicare supplements in particular. They can create a new plan and they can resurface it, but it has to be completely unique from an existing plan out there.
Okay.
So Medicare supplements were established by the Omnibus Budget Reconciliation Act of 1990, and they were implemented in 1992. So that had the old HI and J plans on there, right? Now those were a thing because Medicare used to not cover at-home recovery.
Okay.
All right. So they had an extra benefit on there to cover your at-home recovery.
These
in
HIJs.
hospice. Yes.
Okay.
So in 2010, they modernized Medicare and they said Medicare will now cover hospice and at-home recovery services. Those plans became redundant. So then by default, because they're like, well, Medicare covers that, so I don't need that anymore. So by default, F plan became the highest coverage.
Right.
It wasn't a modification of another benefit. It was making those others redundant.
And it's just the next one up.
Right. And you can't legally sell a benefit that has no reasonable expectation of activation.
Right.
So, I can't sell car insurance to someone without a car. They don't have insurance. They don't have a car. That's theft.
Right.
So what ended up happening is that's why the F plan came out, right? So later, it was until 2015 where Congress passed the rule about not being able to sell new plans to new Medicare eligible enrollees because there's a hold harmless provision. I can't keep people that are already eligible. I can't take something away from them, right? You just can't. That's why they couldn't raise the Medicare Part B premium without an adjustment to Social Security.
Yeah.
It's hold harmless.
Yeah. They worked in conjunction. That's why.
Yeah, you cannot. It looks as a unmitigated penalty and undue burden if someone is depending on a government benefit that they earned in order to pay for a government benefit they also earn. It's the double dipping at that.
Yeah.
So
Paradox.
when that happens, you can't go through there. So then 2015 rolls around, and then we have that issue.
Yeah.
So I can see Medicare getting better and extra benefits in the future, and that will lead to new plans. But the whole point about Medicare and supplements is that they are stable. That's why we should be selling them.
Yeah.
So
I think it's a perfect thing to wrap up on.
hold on a sec. I just got a call, and that was Brandon. Okay.
Yeah, that's in there.
So I think
Oh, you have time to go take your tinfoil hat off. And
Yes. I need to take my.
just, you know what? Just don't touch any of the tap waters that are left in the glasses.
anyway.
Because there's only tap water in this zip code that affects the aliens that come down.
Man, let me call him back. Honestly, maybe he wants to be a part of it. I just hit the wrong button.
Oh, yes. Okay.
I don't know. I'll check it out.
Okay.
Call him back right now. Hey, man.
Do we have a meeting invite or anything? Or?
For today?
Yeah.
Okay.
No, it's about the meeting. All right.
See, I can send out a new one. I just didn't change the time on
Hey, thank you guys for the dojo today. As always, have a great day. Go sell something.